All right, premenstrual dysphoric disorder and iron is the topic for tonight. Could iron be causal? And so if any men are watching and they're wondering what that is, I'm with you. Because obviously we don't have menstrual cycles, so it's not an issue for us unless we have a female in our life that does suffer from it, and it's called PMDD for short. And essentially what it is a PMS on steroids, so to speak. So we're all familiar on some level with PMS, whether that's someone close to us, or we've probably known a woman in our lives that suffered from PMS, or that blames PMS for being snippy to us. So we're familiar with PMS, but maybe not PMDD. But PMDD is a common disorder, affects up to 3 million women a year. It can hit at puberty when menstruation begins, and it can last, as long as the cycle lasts. So up to menopause, and how long that is depends on how long it takes the woman to reach menopause. So 40s, 50s age, depends. Symptoms of PMDD could be severe fatigue, mood changes, including irritability, nervousness, depression, anxiety, annoyance, emotional instability, difficulty concentrating, heart palpitations, paranoia and issues with self-image, coordination difficulties, forgetfulness, behavioral issues. There's a super long list all the way down to back pain and things like that. But primarily or probably most commonly, the way that it would show up in life is the impact on mood and behavior, and how that impacts the relationship of the woman with the people around her. And so what I want to investigate, or just put out there tonight, is it possible that iron overload is contributing to the PMDD? Now, not all PMDD would be iron overload, but if iron overload is a cause of an individual's PMDD and it's not investigated, then they're going to continue to suffer as long as, until post-menopause, until it's discovered. And if they're suffering from it, it's likely that their spouse and people around them are suffering monthly on some level as well. So we want to find it, if for whatever reason it's there, but relevant to this call, we're interested in the iron overload aspect. And so you may remember a previous call we've done where the topic was iron and anxiety. And I just want to review that a little bit here because it's relevant to our call. And in that discussion, we talked about iron overload, or elevated iron, can drive symptoms, broad symptoms, from mood and neurocognitive symptoms to pain, inflammation, autoimmunity. It just depends on where the iron's building up and what tissues, because iron overload drives oxidative stress, and oxidative stress is fancy for what I picture as rusting or aging too fast, inflammation essentially. And so if iron's building up in a given tissue, those are the symptoms you'll have. So when it builds up in the brain, it promotes symptoms of behavior, emotional instability, maybe neurologic symptoms. Restless leg syndrome is associated with iron metabolism. Parkinson's disease is associated with iron metabolism disorders. So there's various things that could manifest if iron's building up in the brain. And we looked at another study that said even schizophrenia and psychiatric illness could be due to iron overload. And so this study looked at 7 patients with varying psychiatric disorders. They had iron overload. When they decreased the iron, the psychiatric symptoms decreased. And so this is the background I want to come from when we're looking at PMDD, because if you speak to the spouses of PMDD, women with PMDD, they might say she's a werewolf, at certain times of the month, or she is schizophrenic, or, may seem bipolar, or things of this nature. They're not actually going to fit bipolar diagnostic criteria or schizophrenia criteria, but it's just a form of speech saying she's a different person around or at different times of the month. So with that background, I want to look at a case study from my practice. And this is a woman who's 32 years old. She's got the PMDD diagnosis, and her husband describes it as, for 2 weeks of every month, I lose my wife. And essentially, you know, they've been married for a few years, you know, dating longer than that. So he's been around for many cycles and basically knows her cycle as if it's his own cycle, because it directly impacts his life for half of his life since he's met her, basically. So if we can improve her experience and her symptoms, that directly improves his life and their marriage. And essentially nothing medical has helped her. So we wanted to investigate, are there things hidden in plain sight that just haven't been looked at that could be contributing to her case? And in her history and medical records, there were clues about iron overload to me. And so I wanted to understand it and investigate it further. So it led me to looking at genetic testing for iron overload. And there's this disease called hereditary hemochromatosis. And that is iron overload to the max. Okay, and it's genetic. So if you have 2 copies of the C282Y gene, 2 bad copies, then you are genetically hemochromatosis. If you have both those copies and the symptoms and your iron panel showing you that, then you're at risk of the worst form, which is essentially the treatment for that is therapeutic phlebotomy, or the person needs to donate blood every so often to literally pull the iron out of them to prevent oxidative stress or high levels of oxidative stress. And if you don't do that, then their lifespan is about 65 years. So literally too much iron is aging them too quickly, and they die of, you know, advanced age at a young age. So we want to find this. And what you're looking for is a lab high ferritin on an iron panel, or a consistently elevated iron saturation that's 45% or above. Those are signs to look for from a lab perspective. And then you're looking for symptoms as well of iron overload. And when they're correlating, then you want to run the genetic testing and see what you find. In this person, we found what you can see here as heterozygous presentation of 2 different genes, which heterozygous is fancy for 1 good copy, 1 bad copy, meaning mom or dad gave her 1 good one, the other one gave her a bad one. So this makes her a carrier, whereas 2 bad copies is the highest risk of hereditary hemochromatosis. 1 bad copy of each makes her a carrier, and you can't diagnose the hemochromatosis, but the carrier status then needs to be correlated with symptoms and other findings. And so in her case, this sets us up for susceptibility for iron overload and makes you pay attention more closely to iron levels that are higher than is lab normal. So she's got the carrier status. What do her irons look like? Since we found this, I wanted to look at serial iron levels to follow her over time and see what does her iron do in correlation with her menstrual cycle. So let's look at that. So what we did is we ran an iron panel for every Monday for 8 weeks straight in hopes to see a pattern in her iron. And this is it laid out on a piece of paper for you. You can see the dates that she was tested, and you can see the iron as it fluctuated. And I apologize, I did not put the values on here. So let me add that quickly. So iron is the first marker. Iron saturation is the second marker. Hard to write with a mouse. This third one is called unsaturated iron binding capacity, so UIBC. This one's total iron binding capacity. And this last one is ferritin. So I apologize for that. So what we're looking for are elevated levels of iron saturation, and or of ferritin. And when you look at your lab result for the quote normal range for iron saturation, you're going to see oftentimes 15% to 55%. But the research says that man or woman, if you're above 45% consistently and symptoms and the case fit it, then you might want to investigate for hemochromatosis. Don't wait till 56%, which would then be lab high. It might be too long. So you can see over 2 months, she ebbs and flows from 45%, which would be the cutoff to make you start thinking that way, to normal at 40%, to lab high at 58, 66, 58 and a 64 in there. You can see she has lab high iron levels at various times, functionally high levels at other times. The purple is lab low for unsaturated iron binding capacity. And that unsaturated iron binding capacity means, if you think of a red blood cell and hemoglobin as iron, it's basically, there's lab low levels there means there's very low amounts of unsaturated binding sites, meaning it's very saturated with iron, okay? And then her ferritin stays in normal range throughout. So that's something else that could trick someone who's considering hemochromatosis or iron overload, but is only looking for ferritin. Oh, the ferritin's not lab high, she's fine. Well, in this case, it's never lab high, it's not even functionally high. So if you weren't paying attention to serum iron and iron saturation, you'd miss it. So you can see the obvious highs and lows here. Now, below the graph, you can see what day of her cycle we were in. So on the 28th, she was in day 2. She felt normal, didn't have symptoms. On the 11th, January 11th, she was day 16, and she said, I feel like my iron is high and I'm on edge. On day 23, it still felt like it was high to her, and she was annoyed and irritable. And then on day 26, she was forgetting a lot. So she had emailed me that she was extra forgetful recently. Like, she was talking to her sister and telling her that she couldn't wait for New Year's, and her sister was confused because New Year's Day had happened 3 weeks ago. Or, she said she'd been forgetting a lot, so she wanted to email me, but she couldn't remember my last name, so she had to ask her husband. So that was day 26 when she was having the forgetfulness. And you jump forward, which would have been on January 21st, you jump forward to January 25th, which is now day 3 of her new cycle. She's been menstruating, and look at that drop in iron numbers. So menstruation dumps iron for her, which changes the clinical case and changes her symptoms as well. So that's part of the 2 weeks of her life that are good in terms of, from her husband's perspective. And then the next month, day 10, she starts being high. 17 and 24, she's high. So what the serial testing showed us is essentially the 3rd week of the month for her, or the 3rd week of her cycle, is, say, Hell Week if you were, rushing for some sort of fraternity or sorority, right? It's when the full moon's out. It's when she turns into the werewolf, whatever your favorite metaphor is. But it's when things go downhill and the iron overload really hits her and changes her mood and behavior, and then, obviously affects her husband's life as well. So what we want to do, knowing that she has the genetics that we can't change, we have to take specific targeted approach to impact her during these times. And so one thing, in her case, and again, I know her case, so I can say this, if you're watching this and you're not a patient, I would not do this unless you are working with a practitioner who's done the testing, knows your case, and can help you with this. But this is just for information only. And so with this case, what we're doing is we're doing time-specific iron chelation during the 3rd week of the cycle to see, okay, if we support dumping of iron at these time points, does that positively impact symptomatology and quality of life? So we're going to find that out here in the coming months. As you can see from the most recent test, it was 2 to 3 weeks ago. So we don't have enough data yet. We haven't even tried that yet, but we're about to head into that. So maybe we can make a video following up to say, here's what happened. But I show you this video to let you know that PMDD, you know, the investigation doesn't include iron status. And if you're someone who suffers with PMDD and you haven't received benefit from typical, you know, treatment from a conventional medical standpoint, you may want to investigate whether iron overload is a factor in your case, like it was for this woman, and, you know, work with someone who can help you out there. So I hope this is helpful. Whether or not you're a woman with PMDD, this presentation should show you that iron matters and could be a contributing factor when overloaded to anxiety, depression, PMDD, all the way up to schizophrenia. And that includes for males too. We don't want too much iron. We don't want too little iron. We want the Goldilocks iron. We want just enough. So that's the detective work for today. If you're looking for detective work in your case, check out my book. It's a bestseller on Amazon called The Autoimmune Answer, and it walks you through 14 different cases from an autoimmune perspective that I worked with, the detective work we did in their cases for their specific disease to help solve their puzzle.